Hello, good afternoon. My name is Changping Yao. I'm an acupuncturist. Welcome to my clinic. This is my patient, Mr. Alan Hockett.
I'm Alan Hockett. I'm a retired architect, and I've been a professional working photographer as well as a practicing architect. I don't practice architecture anymore because of the difficulties of energy and photography. I had stopped doing that at a certain point because of the Parkinson's, and now I'm beginning again. Good. This is my wife, Jean Hockett.
Yeah. Could you introduce yourself a little bit?
I'm Jean Hockett, and I'm a retired clinical psychologist.
Okay.
And I've observed Alan, and he is doing much better now than he was earlier.
I have had Parkinson's for at least 5 years, so I'm told. I didn't understand I had it when I had it in the beginning, and I don't know, I don't know how to measure that, but that's what I've been told. I was scheduled for brain surgery, brain stimulation surgery, and I opted not to do that. And part of the reason for that was that I was not satisfied with the Western medicine's approach to Parkinson's. The Parkinson's symptoms, I lost most of my vision. I could not see a computer screen with any glasses, and I was not registering with my eyes. I had some periods of depression for no apparent current reason that I was told is also characteristics of Parkinson's. A hunched over, curled position, extreme rigidity in the upper muscles of my back and my neck. I could not look to the right or left without causing pain. My neck had been becoming difficult for several years, and both osteopaths and medical doctors had worked on it, and no one made a significant difference. They might have given me a little relief at times, but no one made a significant difference. So I arrived with this problem in my neck, which you could say is part of Parkinson's. I looked at the floor. I wasn't able to raise my head at all. I was very hunched over. My shoulders were very rounded, and when I walked very unsteadily because my body was not in balance of any sort. I shuffled, and I walked very slowly. And I learned later this is kind of a Parkinson walk, but that's what I was doing. My ankles were huge, my legs were large from the knee down, and they discovered, Dr. Ho discovered that I had an edema. My energy level has been very down, it's been decreasing. I have also experienced a series of crises, medical crises in the last 2 years that I was told later that they were not sure if I would survive those crises. So in essence, I was on a roller coaster. I was going way down, I was recovering, but so what? It took me so long to recover, and then the next one happened. Life was not very good. And I was tired of recovering, I needed to fix it so I wouldn't have to have medical crises. But I had been through some very difficult times for 2 years before seeing him, and I felt my immune system was shot, and my energy was extremely bad. I was looking into other alternative methods of trying to address Parkinson's, and Dr. Yao treat me. I have steadily improved in almost every area, probably every area. One, I'm holding my head fairly erect, as you can see in the interview, and I'm not having to cry. Two, my back is much more erect, and I can walk with a purpose, and I'm not wandering around in a hallway, bumping onto doors and things like that. Three, my edema went from, well, how would I describe it? So big, the fever's so big. Now I can wear sandals, but my regular shoes are hard to fit. But my edema came down, I don't know, 90%. And we're still working on it, but this is an amazing thing that has happened. I would say that my gait and my walking, the edema, and my tremors in my neck and my back, straightening my back, have been very critical items, and they have all improved since I came involved. Much more so with Dr. Yao. But basically, I'm here today to say that I'm someone who's had some real problems, serious problems, still have some serious problems, but I've received an enormous relief and reduction in the characteristics and symptoms of these problems. Enormous relief. And I cannot say enough good things about it. I've been involved with acupuncture for years, but it was never as effective as it is now. This is a whole different program, whole different mental approach. More thinking about finding a solution than I've seen before, and some other good things. But that is why I'm here today. I wish to give credence or give record to my experience. I am a photographer, and I am involved with a lot of photographers in the Washington area, and they remember facial characteristics. They remember what they see. And I dropped out of all those activities for several years, and I went back very recently, 2 weeks ago, to an opening, and everyone was amazed. They couldn't believe I was there, even, not in bed, and I looked better, and my eyes were brighter, and my speech was more enthusiastic, more positive. And that has been the case with everyone that I've run into in the last few weeks that has known me before, over time. Everyone has been very positively giving me a lot of positive feedback. So I'm doing the right thing from their point of view. And so that's about it.
Thank you.
Okay?
Yeah.